A medical spa and a regular spa, it's very confusing to figure out which is which, but there's a big difference. When you go to a day spa or something that's called a spa, you're going in when you're thinking about relaxation, massage, facials. You're going to get maybe some light peels and exfoliation type things. You can buy some product there, and it's really nice. There's estheticians in there. They can help you with your skincare, that type of thing. But when you talk about a medical spa, that kicks it up about a million notches, because a medical spa indicates that medical treatments are being done there. Now, you have to remember that in aesthetics or cosmetics, there are two sides to this. There's a surgical side, which you come to me to see about a plastic surgeon, or there's a non-surgical side. The non-surgical side actually, over the past 5 to 8 years, has really just ballooned up because of our technology. We have much better technology today for non-medical type of procedures, or what I call non-surgical procedures. These procedures, although non-surgical, are still medically oriented. Medically oriented such as lasers, laser treatments, injectables such as fillers, Botox, hydrofacials, different types of exfoliative things, products that you can't buy over the counter. They are medical grade products that are distributed by a physician or someone of that licensure. So there's a huge difference between a medical spa and a regular spa. And with those medical treatments, it's usually done in a medical setting, and it falls under many of the same licensure requirements than you would for, say, the surgical side of things. Because even though these procedures are called non-surgical, they're still invasive in many ways. So it requires a specific skill set that you're not going to find in just a day spa or a regular spa. You know, I've been doing this for 26 years. I've done it. I've seen just about everything. I feel like I'm that insurance commercial. I know a thing or two because I've seen a thing or two. So, you know, we've seen a lot. And my biggest fear is that people are going to not make an educated decision. You know, you may come into Center Yourself Rejuvenation Spa and say, you know what, I just don't like it here. And that's okay. Nothing ventured, nothing lost. Go find somewhere where you're comfortable, and if all those things are in place, you have a well-trained, well-licensed provider who does a good job for you, fine. My real fear is going to somebody who just pops up out of the blue or says that they have all these wonderful credentials, can't produce any of them to you. You know, oh yeah, I've taken injectable courses, I'm fully certified. Well, let me see your certificate. Well, I don't have it with me, you know, I don't have it. Look, this is nothing to be trifled with. People are doing these treatments to your body or your face. You really have to do your homework. So my biggest fear is if people don't do that and they get hurt. Well, again, I think that first of all, when you come in, the first thing that has to happen is you have to have a complete analysis of what it is you're looking to do. What are your goals? What are your aims? And then, okay, so we're going to recommend X, Y, and Z treatment. Well, this is, you know, our esthetician. She is fully licensed to do this. This is our nurse practitioner. She's our nurse injector. She's fully licensed nurse practitioner. They will sit you down. They will explain everything about the treatment that you're going to have, why we're doing this treatment, what are the pros, what are the cons, what are the risks, what are the benefits, what can you reasonably expect as a recuperation time, how often will you need to repeat this treatment. And this is a complete educational session that you have before anything hits you. Because if you're just walking out of the blue into a place and they whisk you off into a room and the next thing you know, you've got this flurry of needles coming at you, you ought to be frightened about that. You need to be completely educated about what you're going to have done. There are expiration dates, not only on our cosmeceuticals, but any of the products that we have here. For instance, Botox has a shelf life, and it has an expiration date. And if you're getting Botox, you want to know a couple things. You want to know what I want to see the bottle that you're going to inject. I want to see what the expiration date is, and I want to know how you're diluting it. And you really ought to dilute it right in front of the patient, because here's one of the things that can happen. Somebody over-dilutes it a little bit. Well, they get more Botox out of it. You get less Botox and less effect. They save money, you're still paying the Botox fee. It's a way of kind of gaming the system. So make sure that the dilution is what you want, and it's what the manufacturer recommends. And if it's not, there should be a good reason. All of the products and the peels and everything that we use that touches your face has an expiration date. And we have to make sure that that expiration date is current. If you're using outdated stuff, it's dangerous. It can become dangerous. Glycolic acids can degrade and do things to your skin that they don't do when they're not old. So you have to be very careful about outdated and expired lotions, peels, anything we use back here in the spa, and also anything you buy up front. Ask to see it. One of the hallmarks of things that we offer at a medical spa or any medical spa are laser treatments, different types of lasers, CO2 lasers, YAG lasers, and there's all types of different lasers for different things. But lasers are energy, they're dangerous in the wrong hands. They are a medical grade treatment. So along with that, there are precautions and safety things that have to go along. For instance, the laser has to be well maintained. I would always recommend clients to ask for maintenance records of the laser that I'm going to have fired on my face. It's okay to ask those questions, but when you have a suite of lasers like we do at Center Yourself, we have not only very strict rules that we follow in terms of our laser maintenance, but we also have a laser safety officer. This is a person, a staff member who's trained to do this and makes sure that every part of your laser experience has been reviewed, it's safe, and we are up to what we would call state licensure standards for that particular laser. And that offers a level of safety that is not there if you don't have that person in place. You know, in the course of business, you know, there's going to be times when we offer specials or discounts in order to either introduce a new product or educate patients with regard to a product that we already offer. But you have to be very careful about discounts, because this is not the type of thing that you want to price shop for. Now, of course, when you're looking at cost, it's a real issue in today's day and age. Obviously, we don't want to overpay for a service, but you have to be very careful about discounts and how things are priced. Because if you're out there price shopping, you know, you're not going to go to a low-end store to buy a high-end product. You want to go to somebody who has experience with that higher-end product. So when something is too good to be true, sometimes it is. So when you're looking at these, for instance, I'll use Botox, for instance. If you say, you know, everybody price shops their Botox because there's a lot of different practitioners that are providing that service. So if you see somebody who's charging, and it's usually charged by the unit, $12 to $13 a unit, and over here is practitioner Jones who's pricing it at $9 a unit, that's ridiculously low, and they're either taking a bath or they're diluting their Botox down to the point where it doesn't hardly work, and you think you're getting a deal, but you really aren't. This is not the type of product and delivery that you want to really look for super discounts. These are medical grade treatments that have a price that goes along with it. Of course, there's regional and geographic price norms that most practitioners will stay within, and it's going to vary a little bit, but these are medical grade treatments, and you don't want to be chintzy, so to speak, with how you go about finding them. Social media is a nice place. There's a lot of information out there, but it's completely unregulated. There's absolutely no way to know if you're on a good site, bad site, whatever. We put on our website, we have as much information as we can. So, you know, you want to go to a credible website, something that's not just self-serving. For instance, American Society of Aesthetic Plastic Surgeons has a great website. It talks about both surgical and non-surgical treatments and what's out there. It educates a little bit. There's different websites such as that are reputable. There's an awful lot of unregulated stuff out there as well. That's why we have a large internet presence. We come on, we do Facebook Fridays, live Facebook things. We do on Instagram. So we're out there and we're trying to educate. But there's a lot of people that are just out there and just purely advertising and trying to get you into their place. So it's one of those things where you have to be really, really careful. Whether we're talking about surgery, whether we're talking about non-surgical treatments, you're your own advocate. And if you don't, and a lot of people are afraid to ask questions. They're afraid, oh, I'm not going to ask too many questions because people get mad at me. And I don't want the person putting a needle in my face being angry at me. You know, so they won't ask the question. But if they get angry because you're asking questions about your treatment, as I said before, turn around and walk out the door. Don't stay there, because that should not happen.